The hidden dangers lurking in common UTIs. Most people think of a urinary tract infection, or UTI, as a simple, irritating condition. But for senior women, it can be far more dangerous, often showing up as confusion, dizziness, or even sudden falls before any traditional symptoms like pain or burning appear. The reason? Aging bodies respond differently, and the signs of infection often go unnoticed until something goes terribly wrong. In this video, we'll reveal how UTIs in senior women are misunderstood, misdiagnosed, and far too often missed completely, until a trip to the ER exposes the real issue. Doctors now warn that what seems like a mental health issue or balance disorder may actually be a silent, fast-moving UTI. You'll learn why older women are more prone to UTIs, the unusual signs that are often missed, the connection between UTIs and confusion, dementia-like symptoms and falls, real stories of women misdiagnosed, what caregivers must watch for, and how to prevent UTIs naturally and medically. Let's dive into the truth that could save your independence, your memory, or even your life. And we'll also discuss how this seemingly minor issue connects to long-term brain health, hospitalizations, and even the risk of losing independence. UTIs are not just an infection. They can become a catalyst for a cascade of medical complications that spiral out of control. Let's begin by understanding why senior women are more vulnerable to UTIs. After menopause, estrogen levels drop dramatically. Estrogen plays a key role in keeping the lining of the urinary tract healthy, supporting beneficial vaginal bacteria, and maintaining a strong immune response. With lower estrogen, the body becomes much more susceptible to infections. But that's just one part of the puzzle. Older women often struggle with incomplete bladder emptying, either due to weakened pelvic muscles, medications, or chronic conditions like diabetes. High blood sugar provides a breeding ground for bacteria, while reduced immune response makes it harder to fight off infections once they start. Urinary catheters, incontinence products, and less frequent sexual activity also increase risk. Even something as simple as dehydration can be a huge factor. When urine becomes too concentrated, bacteria thrive in the stagnant fluid. Over 50% of senior women will experience recurrent UTIs, many of which go undiagnosed because symptoms aren't typical. In women with dementia or cognitive issues, they may not even be able to express that something's wrong. It's not just about the bladder, it's about the whole body. Limited mobility can make it harder to get to a bathroom in time, leading to urine retention, which further encourages bacterial overgrowth. Hormonal shifts disrupt the body's microbiome, tipping the balance toward harmful bacteria. Recurrent infections damage the lining of the urinary tract and can progress into serious kidney infections, or require hospitalization with IV antibiotics. UTIs in older women are not just common, they're persistent and dangerous. Now here's where things get even more alarming: the confusion UTI connection. One of the scariest aspects of UTIs in older women is how they affect the brain. A simple infection can trigger systemic inflammation that impacts mental function. The result? Sudden confusion, memory loss, hallucinations, slurred speech, agitation, or even withdrawal from loved ones. It's absolutely heartbreaking. Families may believe their mother or grandmother is developing dementia, when in fact the real issue is a hidden infection. This happens because as we age, the blood-brain barrier becomes more permeable, allowing inflammatory chemicals to disrupt brain chemistry. Many older adults are also on multiple medications that can amplify the effects of infection. That's why any sudden change in mental status, especially in a senior woman, should immediately be evaluated for a possible UTI. Consider Mary, age 72, who was rushed to the ER for confusion and slurred speech. Doctors feared a stroke, but it turned out to be a UTI, with no urinary symptoms whatsoever. Delirium from a UTI can last days or even weeks, and without prompt treatment, the cognitive damage may linger. Families need to observe closely, document unusual behavior, and speak up during medical visits. Insist on a urine test before accepting a diagnosis of dementia or psychiatric illness. It could save someone's mind and their dignity. Let's talk about another hidden danger: falls. When a UTI causes confusion, disorientation, or even fatigue, It significantly increases the risk of falling. Senior women are already more prone to balance issues, and an untreated infection adds a dangerous layer. UTIs can cause dizziness, low blood pressure, muscle weakness, and poor coordination, all of which contribute to falls. 1 in 3 seniors falls each year. Falls are the leading cause of injury-related death for people over 65, and women are more likely to suffer fractures due to osteoporosis. What may start as a small infection can spiral into a hospital stay, surgery, or the loss of independent living. What's worse is that many of these incidents are completely preventable. Fear of falling can lead to a sedentary lifestyle, which reduces strength, fosters depression, and increases the likelihood of more falls. Caregivers should do regular home safety checks, install grab bars, improve lighting, ensure safe footwear, and look for early UTI signs. Some women fall while rushing to the bathroom because of urgency triggered by infection. Others fall at night when confusion sets in. These are not just random accidents, they're symptoms of something deeper. Recognizing the cause means preventing the next crisis. Now let's address a major misconception. Not all UTIs burn. Most people expect the classic signs: pain while urinating, urgency, and lower abdominal cramping. But in older women, the symptoms can be entirely silent. That's right, no pain, no burning, and often no fever. Instead, you might notice subtle clues like loss of appetite, increased sleepiness, incontinence getting worse, behavior changes, or a low-grade fever. Caregivers often dismiss these signs as normal aging or side effects of medication, but they can indicate a brewing infection. Knowing what's normal for your loved one is crucial. If someone suddenly becomes lethargic or loses interest in eating, it's time to investigate. Silent UTIs can linger for weeks, slowly undermining health. In care facilities, these infections can spread from patient to patient, especially when staff is unaware of atypical symptoms. Recognizing the unusual signs helps prevent outbreaks and unnecessary antibiotic use. Staying alert can make all the difference. So, what can be done to prevent UTIs before they start? Thankfully, there are several effective and natural steps to reduce risk. Hydration is the first and most important strategy. Drinking at least 6 to 8 glasses of water a day keeps urine flowing and bacteria flushed out. Herbal teas like dandelion or cranberry can help, but caffeine and alcohol should be limited because they irritate the bladder. Hygiene is another critical piece. Wipe front to back, avoid perfumed products, urinate after intimacy, and change incontinence pads frequently. From a nutritional standpoint, cranberry extract, not sugary juice, can help prevent bacteria from adhering to the bladder walls. D-mannose powder is another supplement shown to block bacterial growth. Probiotics, especially those designed for vaginal or urinary health, help restore a healthy microbiome. Vitamin C supports immunity, and a balanced diet goes a long way in maintaining overall resilience. Speak to your doctor about estrogen vaginal creams, especially if recurrent infections are a problem. If you've had multiple UTIs, consider regular urine testing, medication review, and consultation with a urologist. Yoga and pelvic floor exercises can help strengthen bladder control, while avoiding tight synthetic underwear keeps the area breathable. For diabetic women, maintaining healthy blood sugar levels is key. Caregivers and loved ones are often the first to notice something is wrong, so they play a vital role in early detection and prevention. If you're caring for an aging parent, spouse, or friend, be proactive. Monitor sudden changes in mood, behavior, or physical ability. Encourage fluid intake, help with hygiene, and don't wait to seek medical attention when something feels off. Keep a symptom journal, especially if confusion or incontinence increases. Advocate for your loved one at medical appointments. Request urine tests, discuss recurring symptoms, and push for answers. Don't let vague diagnoses like aging or memory issues go unquestioned. You know your loved one best. Use reminder apps for medication, join support groups, and make safety a team effort. But when should you go to the doctor? Don't wait until things get worse. UTIs in seniors can escalate quickly and lead to sepsis, a life-threatening condition. Red flags include sudden mental confusion, unexplained falls, shivering, dark or foul-smelling urine, fever, nausea, or vomiting. These symptoms warrant immediate attention. Recurrent infections may suggest deeper issues like kidney stones, bladder prolapse, or hygiene challenges. Ask for imaging tests or specialist referrals when necessary. Early testing and a short course of antibiotics can stop the cascade before it begins. Prevention is important, but quick response can be life-saving. Let's ground all of this in real stories, because the statistics don't tell the full tale. Linda, age 75, became angry and forgetful. Her daughter feared early Alzheimer's, but a nurse suggested a urine test. It was a UTI. After treatment, Linda returned to her normal self. Joan, 80, fell twice in 1 week. Her doctor found nothing unusual until a geriatrician ordered a urinalysis, another hidden UTI. Margaret, 67, was hallucinating and losing her appetite. Her husband thought she was losing her mind. A quick test revealed infection, and a full recovery followed. Perhaps most striking is Rosa, 79, who was placed in memory care with a diagnosis of late-stage dementia. Her daughter demanded a full evaluation. It turned out Rosa had a chronic, untreated UTI. After aggressive treatment, she made a near-complete cognitive recovery. These stories aren't rare. They're happening every day. Families that trusted their instincts, asked questions, and demanded testing helped their loved ones avoid unnecessary suffering. Finally, let's talk about long-term prevention and building a support system. Moisture-wicking underwear, consistent hydration, and daily habits that promote hygiene and immunity are key. Keep a journal of recurring symptoms. Work closely with a geriatric team. Stay active with gentle exercises to improve circulation and immune response. Rotate probiotics to keep your gut microbiome balanced. Consider using bidets or warm water rinses instead of toilet paper for better hygiene. Join senior wellness communities, both online and in person. Use tools like medication reminders and emergency contact apps. If you've had multiple infections, talk to your doctor about the pros and cons of long-term antibiotics. And most of all, educate yourself. Knowledge is prevention. Conclusion: a UTI might seem like a small inconvenience, but in senior women, it can lead to cascading health crises. Confusion, fractures, hospitalization, or even misdiagnosed dementia. Awareness, early testing, and prevention are key to protecting not just your bladder, but your brain, independence, and quality of life. Don't wait. Stay hydrated, stay informed, and speak up for yourself or someone you love. If you found this video helpful, hit like, subscribe, and share it with someone who needs to hear this. We create weekly videos focused on senior wellness, healthy aging, fall prevention, and cognitive health, because every woman deserves to age with dignity, confidence, and strength.